Hi there, I'm Dr. Grant Blashki from familydoctor.expert, and today we're going to talk about family genetic risk. They say you can choose your friends but you can't choose your family, and that's certainly true. And your family's genetic risk obviously has impacts for you too. So fortunately, Professor John Emery has recently developed the Family Health Questionnaire, and there are 9 questions. They only take a couple of minutes to answer, and if you answer yes to any of these, it would be a really good idea to go and have a chat to your GP, see if they can put in place some preventive strategies or perhaps refer you. So the first question is, have any of your relatives had heart disease before the age of 60? And by heart disease, we include in that cardiovascular disease, heart attacks, angina, and bypass surgery. Secondly, have any of your close relatives had diabetes? And by diabetes, we include in that type 2 diabetes, or what's sometimes called non-insulin dependent diabetes. Thirdly, have any of your close relatives had melanoma? Next question, have any of your close relatives had bowel cancer below the age of 55 years? Do you have more than one relative on the same side of the family who's had bowel cancer at any age? And think broadly here about parents, children, brothers, sisters, grandparents, aunts and aunties, nieces and nephews, and even grandchildren. The next question to consider, have any of your close male relatives had prostate cancer before the age of 60? Have any of your close female relatives had ovarian cancer? Have any of your close relatives had breast cancer before the age of 50? And finally, do you have more than one relative on the same side of your family who's had breast cancer at any age? And again, consider that quite broadly. Consider parents, children, brothers, sisters, grandparents, aunts and aunties, uncles, nieces, nephews and grandchildren. So you can see from these 9 questions that have been put together by Professor John Emery from the University of Melbourne with his colleagues that it's a good screen and a good way to sort of just have a think about things that might run in your family. Obviously, it doesn't include every possible genetic risk. It also doesn't really consider any of the sort of prenatal genetic issues that we're increasingly thinking about when people plan to have children. But as a screen of risks for individuals is very helpful, and I recommend that you consider those questions and go along to chat to your GP if you said yes to any of them. So I wish you well from familydoctor.expert.